Thank you, Ariba, for having me here, and thank you, everybody, for coming. So my name's Holly. I am the health promotion educator here at York University. My department is Student Counseling, Health, and Wellbeing, and my specific unit is Health Education and Promotion. You don't have to remember that. Don't worry, we're going to be talking about it. And today we are going to be talking about health and why it's important to prioritize that as a student. So just a quick review of what the agenda is going to be. So first we're going to be talking about transition and stress. Then we'll be going into talking about health and well-being as a post-secondary student. And then we'll get right into the important part, what everybody's here for, and that's to learn about the services that are available. So talking about my department, which is Student Counseling, Health and Wellbeing, the units within it, how to access our services, and everything that we offer. So we'll just start. So starting with first year transition. Now I'm not quite sure in the audience if I have parents here, is this students? Do I have both? But I want to talk about the first year transition because this is a big thing that we don't actually talk about a lot. You're at a point where you're looking at schools, you're trying to figure out where you're going to go, what you're going to study, and there's a lot of stress about making those decisions, but we don't typically talk about what it's actually like to transition from high school to post-secondary. This transition when you're going from a high school setting to post-secondary education, it's often a time of self-discovery and exploration for students, and it's a time of increased freedoms and autonomy where young adults, some older as well, begin to make your own decisions. You're taking more responsibility for yourself. Perhaps there's a lot more increased independence financially. You're having a change in your relationships, and that could be your friends, your family, and all these things are really fun and exciting. And a lot of young adults really do enjoy these things. That being said, it's also a time of increased vulnerability and stress. As you start to shift towards this independence, this increased responsibility, as fun as it could be, it can add a lot of stress. I mean, you have things now like you have to do your groceries, maybe you're doing your cooking, you have bills, you have to wake yourself up in the morning, you have to put yourself to bed. Like, though these things sound simple, you don't realize how much support you might have been getting previously when you're all by yourself. And this does require much more executive self-regulation. So this takes into account things like your self-control, your self-discipline. And when you add in like increased academic demand, this can be really unsettling, and it does increase feelings of stress, anxiety, and uncertainty. Now, what I want everyone here to know, whether you're a parent or whether you're a student, is that these feelings of stress and anxiety aren't necessarily a bad thing. Stress is a normal part of life. It's a natural human response, and it's what prompts us to address the challenges and threats or change of any kind, really, in our lives. And we all experience it from time to time, and it's these challenges that really help us grow individually, socially, academically, and professionally. So I want you to actually take a quick moment. You don't have to share this. It's just like your own little self-reflection. If you are the student, I want you to do the reflection for yourself. And if you're the parent of a student, the reflection is for you. Or of your student, I want you to think for a moment about a stressor that you as a student or your student just faced successfully, meaning that you were able to overcome the stressor and get the desired result that you wanted. And maybe you even grew from it. To put some ideas in your head, some examples could be overcoming a challenging class in high school, or getting a great mark on a very stressful assignment. It could also be something like dealing with a difficult relationship, perhaps a partner or a change in your friendship, just something that created a lot of stress in your life most recently, let's say in the past year, that you were able to overcome successfully and you were able to cope with. So just think about it, keep it to yourself. This is just for your own self-reflection. We are going to come back to it. So before we talk about that, I want to just introduce you to what's called the stress curve. This was originally discussed way back in 1970s by Dr. Selye. But here the curve line shows how performance levels can rise, peak, and fall as demands increase, and how much how too much or too little can hinder performance. And on one end of this graph, you can see that too little stress or mental stimulation may cause individuals to experience boredom, lack of motivation, which results in lower performance and drive. You might not be feeling stressed, but you're not working well either. As the curve goes up and demands and challenges start to increase, you'll see that when demand is higher, but staying within a manageable range, this is actually helping with motivation. It's increasing productivity, and it's contributing to achieving your goal. So it's a good thing. Like being right on that hump, that's a good thing. But unfortunately, there is a point where demands can get to be too much and too stressful. And at this point, this is when performance can start to go down, demands aren't being met, and we start getting feelings of being tired, exhausted, perhaps anxious, overwhelmed, eventually just leading to burnout, um, especially if that demand doesn't decrease. Um, and the stress curve and its role on performance is important for both students and parents to understand, as it shows that nervousness and excitement and stress, which you're going to experience as part of your first year transition, um, are all part of growth, but we all have our limits, and it is really important to recognize and normalize seeking supports when we do begin to reach those limits. So just before we do dive into talking about what supports are available to you or your student, we just want to introduce you to the Wellness Wheel, which is a core framework in how we approach health and well-being at York University. Uh, we often talk about the aspects of health pertaining to the physical health. However, the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This definition shows that health and well-being are multifaceted, meaning there are multiple factors and determinants that could contribute to the health and well-being of an individual, and therefore we must take a multifaceted approach to address all these factors. And as you can see on the wheel that there are 7 aspects highlighted on the wheel, all of which contributed to quality of life and academic success. We have physical, we have emotional, we have social, financial, academic, environmental, and spiritual. And each of these 7 aspects are of equal importance while also being interconnected. And any imbalance in one area can impact another area. So on that previous slide, I had you take a moment to reflect. So I want to go back to that. So thinking about that stressor that you as the student or that your son or daughter overcame successfully, can you notice which aspects of their well-being might have contributed to their resiliency and their ability to overcome that particular stressor? And you can look at all aspects on that wheel, but one thing you can look at is, let's say, social. What kind of social support did they have? Did they come to you when you were supporting them? Did they have friends? Did they have a coach? Did they have access to different community supports? What was available to them within the community or within the school itself that might have helped them overcome that stressor? Where was their physical health at? Were they sleeping well? Were they eating right? Were they engaged in physical activity? Did these help them overcome that stressor? Where were they at spiritually? Where were they at academically? Perhaps they had different workloads or they're better managing their other academics, meaning that they could focus all their energy into that assignment or that class to give them what they needed to overcome the challenge. I just want to demonstrate that how you as a student, your well-being academically is very much connected to how you're supported in all areas of well-being. And by attending to all dimensions of health and achieving balance, um, you know, folks, individuals, everyone can just develop resiliency, adaptability, and greater capacity to navigate life's challenges and achieve academic success. So now we'll get into talking about the supports that are available. So our department is Student Counseling, Health and Wellbeing, SCHW for short. We're located at the Bennett Center for Student Success on the Kiel campus. You can put in the address. You can also just put Bennett Center in Google Maps. It comes right up. When you do get here, you'll see that we have quite a large campus, and Google Maps is going to be your best friend for finding all the different buildings. But anyways, so Student Counseling, Health and Wellbeing is a student service department within the Division of Students. We have a dynamic team of healthcare professionals, peer health educators, and various support staff that collaborate to provide a range of health and well-being services that foster academic success, student development, and an engaged community. The department is comprised of 3 units. We have student counseling, health services, health education, and promotion. And then we have well-being, and we're going to dive deeper into each of these services and how to access them. So starting with student counseling. So I guess a big question that many of you might have is, why do students come for counseling? There are different reasons individuals do seek out counseling services, and I just want to preface this that sometimes you don't necessarily need a reason. You don't need to have a problem or a concern to seek out counseling. Sometimes counseling can just be used as maintenance, like just talking to somebody once in a while, getting everything out and on the table. It's kind of just like changing oil in your car. There may be nothing wrong with your car, but it's still something you have to do on a regular basis, and it keeps everything running smoothly. But I will just provide some insight as to what the primary reasons we do see students at SCHW. The top 5, which are the darker circles shown here. So we have stress and feelings of anxiousness, which we talked about. You know, you're in your first year, you're transitioning, you're taking on a lot, and this is very stressful. So it's completely normal and completely expected that you're going to be feeling anxious and you're going to be feeling stressed. Another one is academics, which again, you're going through a whole new way of learning. How you learn in high school and how you learn in post-secondary are 2 completely different things. You're taking on different course loads. There's a lot more information coming at you, so it's completely normal for academics to start to feel overwhelming, also contributing to those feelings of stress and anxiousness. They come in for feelings of depression, which if you're not managing your stress and those feelings of anxiousness, again, it's to be expected. And then the last one that I want to point out is interpersonal relationships. And this could be, within your family, it could be with your friends, it could be with a roommate. And it may not necessarily even just be conflict. It could be just like you might start to feel lonely. Like we have a huge campus. There's a lot of students here, but regardless of where you go, sometimes it can be difficult to start meeting new people, and this can cause a lot of stress and anxiety and feelings of depression. And I just want to let everybody know, like, you're not alone on this. Some other reasons that we've also seen students does include things like trauma, sexuality, identity, disordered eating patterns, suicidality, as well as past or current abuse. So in terms of the services that are available, so we offer same-day individual counseling to students free of charge. And this provides timely access for students to a qualified mental health professional. The reason we have the same-day model is that we can support the student in your exact moment of need. So it's not Tuesday and I'm completely stressed and overwhelmed, I need to talk to somebody, but I have to wait 2 to 3 weeks to get an appointment where the problem either went away or it's escalated. We want to support you right then and there in the moment when you need it. So it is on a same day basis, and this can be accessed both in person and virtually. For students to access it in person, you just need to come to the Bennett Center. Our hours are between 9 and 4 p.m. and no appointment necessary. It's given out on a first come, first serve basis. I just recommend students do come earlier in the day if they can, just to ensure that they do have a spot. You can also access our services online by following the link on the screen, and I'm sure we'll get it posted in the chat as well. And in this case, every day we put the counselors up for the day who will be available virtually at 8:45 in the morning. You'll see all the counselors, what time they're available, and you'll be able to pre-book your spot between 9 and 4 o'clock, the same hours as the in-person. We just ask that students do this in a private space. So you don't want to be doing it in the middle of Vari Hall when there's a whole bunch of other students walking around you. Make sure you do have a quiet space that you can do this and just good secure internet access. What I do want to highlight is that the use of this service is completely confidential. So we don't tell anybody that you've come for counseling. So a professor can't ask about it, an employer can't ask about it, your parents can't even call us and ask us about it. You coming in for counseling stays here. It's not shared with anybody else. So I really just want to make sure I do highlight that. And when you do come in for a counseling session, the sessions are about 50 minutes, plus or minus 5 minutes. So make sure you do plan enough time for that. And I know it says on the screen Monday to Friday, 9 till 3. And that's just because the last session we'll give out is at 3 o'clock because the office closes at 4. So just try to come before 3 if you can. In addition to same-day counseling, we also have short-term counseling, and this is where you can come in for 6 to 8 sessions and meet with a counselor. Just quickly going back, I did forget to mention that as part of the same-day counseling, there's no commitment, so you can come just that one time, talk to the counselor, they'll give you some tools and resources, and you'll go on your way, you put them into practice, and you're good. If after 3, 4 weeks you find it's still not working, you can come back for another session, meet another counselor, or say it's like 3, 4 months later and it's a completely different problem. You can just come back in and just do that single session. That's completely okay. All right. But we do offer short-term counseling for students that are looking for it. So in this case, you'll meet with a counselor for 6 to 8 sessions, a combination of in-person and virtually, just based on your schedule and the counselor's availability. Um, And there is no cap on this. So again, let's say you come in for that same day appointment, you talk to the counselor, you discuss that you do want to do short-term counseling, you go through your 6 to 8 sessions, and then everything's great. You're sent on your way, but then maybe 2, 3 months later, another problem comes up. You just come back for another same day individual appointment, and you can discuss with that counselor about continuing short-term counseling as well. Now, because our services are only available Monday to Friday, 9 a.m. closing at 4 p.m., we do like to make sure students are covered around the clock, because obviously mental health doesn't take a break. And it's not happening every day, on a Monday at noon. It's happening Friday at 7 p.m., Saturday at 1 o'clock in the afternoon. It happens at all hour of the days. It's unpredictable. So we do have a partnership with an organization called Keep Me Safe, and they provide free mental health counseling online, by phone, as well as texting. And what's great about them is that they offer it in over 140 languages, which means that you can pick which language you're most comfortable with, and connect with a counselor who speaks that same language. You can also access their services anywhere in the world. And this is most important for any of you who might be coming from abroad, because you can still access this service if you go home on a break. So say you're York University students, but you live in the United Kingdom, or maybe you're coming from India. So you can still access our services at any time of the day. It's 24 hours, 365 days of the year. So you can access them anytime, anywhere in the world, in multiple languages. So it's really great that way. So to access them, you can either call them, which is the number on the screen. You can go to their website. You can scan the QR code. They do have an app. Now, the app was previously called My SSP, and if you do search that in the App Store, the right app will still come up. It's just been rebranded to be called My Student Support app. So look up My Student Support app or My SSP. The same app will come up for you. We also have a community partnership with Ontario Shores Centre for Mental Health Sciences. And what's great about this partnership, so for Ontario Shores, they offer cognitive behavior therapy in a step care framework, which means that they're going to determine which type of therapy is going to be most suitable and meet your needs. And what's great about them is that you can access them with or without coming through us. You don't need to go through a doctor to do it. You can actually go to their website and refer yourself to access their services, and no OHIP is required. Once you fill out the paperwork online, they'll bring you in for an assessment and then determine what's going to be best suitable for you. So is that going to be self-administered tools and strategies? Is that going to be a weekly one-to-one or group therapy? They also offer it in person and virtually. The partnership that we do have with them is that if you are going through the one-to-one therapy, we do have a representative from Ontario Shores sitting physically in our office once a week. So you don't need to worry about leaving campus or coordinating around your classes to meet that appointment. We have them right here on campus for you. In addition to Ontario Shores and Keep Me Safe, which are definitely the primary ones that I do recommend, there are also many free community supports available to post-secondary students. One of them is What's Up Walk-In, which offers in-person walk-in counseling, so similar model as we have, where it's just same day, you just walk in on an as-needed basis. And they have 29 locations around within Toronto, within the GTA, and they offer up to 6 sessions, and they're available Monday to Saturday, free of charge. And then there's also Good to Talk, which offers 24/7 free confidential telephone support. You can also text them as well, and it's specific to post-secondary students as well. So I highly recommend that one as an alternative to Keep Me Safe. Next up is we're going to talk about health services, health education, and promotion, which is my unit. So I'm very excited about that. So starting with our public health nurses. So public health nurses, if you don't know, they do have this unique role in the healthcare system because they focus on the overall health of the community. They use a preventative upstream approach to health by providing communities with resources and tools they need to remain healthy and prevent illness rather than the downstream approach, which focuses on providing individual treatment and disease management. And their role at York University is to provide students with programs and services that create a healthy campus environment. They help bridge the gap in accessing healthcare services by providing them on campus and meeting students where they are. Some of the programming that they have. So the first thing I'll put on your radar is they offer a health fair. And this health fair is going to be available at Kiel, Glendon, and Markham. And that's going to be happening in and around October, which is going to be a great opportunity to connect you with various resources that are available to you both on campus and within the community, bringing everybody together in the center of the campus. And there'll be plenty of fun giveaways and information to be given out. They'll also be launching what's called Ask a Nurse. And what these are is they'll be providing health consultations to give students an opportunity to ask a registered nurse their health related questions. Um, they also have blog posts. They have harm reduction kits, which are available upon request. They also do health education. So they do partner with different departments on campus, and they'll come in and do presentations like navigating the healthcare system, asking different questions specific to healthcare, which I know is can be very confusing, both to international students, but even those domestic students. If your parents were handling all this before, it can be really complicated sometimes trying to navigate doctor's appointments and how to handle those. So they offer workshops on that. You can also catch them on social media where they'll release different health education information through reels, different Instagram posts, stories. They also provide guidance to the campus on different issues related to public health. So that could be things like communicable diseases and monitoring epidemiology trends, things like COVID and flu, all that stuff. We also have health education and promotion. So at colleges and university, health education and promotion does serve as the core mission of higher education by supporting students and creating these healthy learning environments. It is an essential part of healthcare, which supports the promotion and maintenance of healthy behaviors. And it's through health education and promotion that our department seeks to support students to understand their behaviors and how it affects their health and encourage students to make their own choices for a healthier life. We do offer a range of services, including training programs, different workshops, fun engagement events, campus and community collaborations, and we also do regular outreach initiatives. So we can engage with the York community, we can connect with students, and we provide various resources and referrals, both for on and off campus supports, so we can help meet your needs. So thinking back to that wellness wheel that we did probably about 10 minutes ago now, but I hope you all remember. But the wellness wheel was physical, emotional, social, financial, academic, environmental, and spiritual health. And as each part is connected, myself and I actually have a team of peer health educators, which are work study students, so students like yourself who are just super passionate about health and well-being. So we work together and strive to support the whole health by providing education and resources covering all areas of health. Here you can see just a few examples of the workshops that we do provide. So you can see we have substance use, we have sleep and physical health, nutrition, self-care, compassion, sexual health, and mental health. And we also offer things like yoga. We launched knitting this year. If you didn't know, knitting is actually very good for your mental health. We do boot camps, painting, bracelet making, all these fun interactive wellness events. And the one that I really want to highlight is our navigation series. And the navigation series is going to be a little bit more in depth than what we talked about today. But we have navigating mental health resources, navigating physical health resources, and then navigating queer resources. So in this case, we'll talk about mental health specifically or physical health, depending on the topic. And then we'll go do a deep dive in terms of all the resources that are available to you on campus or within the community. And this is really good that if you or you know somebody else who missed this presentation or any of the other orientation presentations where we talk about resources, you'll be able to get all that information there as well, or if you forget. And the last unit is well-being. So well-being, this team focuses on understanding the current needs and priorities of the York community through a pan-university approach. Sorry. Addressing well-being across all York campuses and sites. The goal of this strategy is that students, staff, faculty, and instructors, everyone can flourish and be well in this shared environment. Some examples of things that Wellbeing has carried out. So they do a lot of community engagements. When you walk around campus, you'll probably see their QR codes everywhere because they're constantly trying to get more information from you about things that we're doing well, things that we're not doing well. What can we add? What do you want to see? So they're constantly trying to get more information from you. They have a student-led well-being podcast. So similar to peer health educators, these are work study students, super passionate about health and well-being, super passionate about podcast and media, and they're trying to spread the word on campus through their own podcast. It is available on Spotify. They also recently carried out what was called the Canadian Campus Wellbeing Survey. And this survey was distributed across campuses back in 2022 across North America, and it really collected a lot of information on the health status and the knowledge of students, and provided great insight on what we're doing well and where we could improve, and just provided the evidence-based resources we needed to really drive different initiatives and programs across campus. And they'll actually be doing another one, I believe, this coming winter. So winter 2025, they'll be launching another survey. So I highly recommend students also partake in that because it really helps you as a student and future students coming in. And that's all I have. So I'm here to answer any questions that you might have.
Thank you so much, Holly. There was so much amazing information there. I think Bushra got some questions in the chat privately to her, so I'll just pass it over to her.
Yeah, so we have three questions. So the first question is, how does York encourage students to seek help when needed and reduce the stigma surrounding mental health issues?
So The first one is making sure that as part of orientation, like these, I guess, pre-arrival presentations, we really focus on mental health and trying to normalize it, trying to reduce the stigma around it. We do a lot of community engagement. So we stand out in a table and where all students can see us, and we have all the resources available. We talk to students about mental health. And we also offer various workshops all throughout the year, not just our department, but the other departments as well, really trying to get that information out there about we all have mental health, and making sure students know like it's completely okay to not be okay. And we just really try to promote all the resources that are available to them. I hope that helps.
Thank you. So the next question is, are there opportunities for students to engage in physical activities, sports, or wellness program as part of their academic experience?
So I just want to clarify, do you mean like for credit or just like that those things are available while they're studying?
Yeah, while they're studying, and even credit if there is any.
Yeah, so there is a gym on campus, Tate McKenzie, and their website, I believe, if you look up, would be Athletics and Recreation. So for students, as part of your tuition, you have free access to the gym, but I'll just divide it up. So they have things like a pool, they have squash courts, indoors and outdoors. So you can access those all for free. That's part of your tuition. And I do believe they offer some classes free throughout the year as well. And there is like a gym, so like that, like, gym with weights, cardio machines. And that one is, I believe, $25 for the membership, but it's for the whole year. And you won't find that price at any other type of gym. So it's $25 for the whole year, which will give you access to the weight training room. And that gives you access to all their classes. And I know there's things like there's boot camps, there's kickboxing. I think they do a high intensity training. They have yoga. So they're offering that. So that's how you can be more physically active. As well within my department. So it's not our main focus, but we do offer here and there boot camps and yoga as well. In different departments, they'll be putting posters throughout the year when they're hosting a specific wellness event as well, all free of charge for students.
Thank you. So the last question is, how does York address the unique health needs of diverse student populations, including international students, students with disabilities, or those from marginalized communities? And I do believe you did go into that, so if you can just talk about it again.
So we work very collaboratively with all the different departments on campus to try to increase knowledge and awareness of the resources that are available to them. Specifically for the international students, we do a lot of collaboration with York International to host different workshops, and to provide them information as well to put out on their social media for those who can't make it. And I guess the main support that we have is those two public health nurses where you can come and do the Ask a Nurse session, where you can come in and ask them your questions and they'll direct you where to go from there, whether or not you need to go to a doctor, which clinic's going to be best for you. And then they also, with York International, they have the workshops where it's about navigating the Canadian healthcare system. York International also have what's called coffee breaks, and it's not for healthcare specific. Their coffee breaks, and it's called a coffee break, but it's you go into York International, into their main lounge, and they host these events to bring all the international students together. And they'll cover different topics. So whether or not that's transitioning from where you lived before, and the culture shock of being here, whether that's navigating healthcare, or anything that can be really confusing about coming into a new country, they cover different topics that way. And I think in terms of making sure that we do cater to the different diverse populations, our public health nurses we really heavily rely on them. So they'll be there for their Ask the Nurse sessions. They have their blog posts, and they're really out in the community offering. They also table as well. They offer vaccine clinics, and they're really kind of bringing back that information that we need. I'll also say is so on campus, we do have one walk-in clinic available on campus, and that is the Apple Tree Medical. But we do have a partnership with another clinic nearby, called Black Creek, and they're, I think, maybe a 15-20 minutes from here as well. And I guess the great thing about them is they are very heavily involved in the community. They support individuals from diverse backgrounds. And for international students specifically, if you haven't looked too much into UHIP and what that covers. Typically, when you use UHIP, it comes with a copay, so a small additional charge to access healthcare services, depending on where you go. But with if you go to the Black Creek community, because we have that partnership there, they waive the copay. So yeah, I hope that helps.
Yeah, thank you so much.
Okay, so great. Thank you so much, Holly, for answering all those questions. So just to wrap up, we do have the recording of this presentation will be shared on our YouTube, which we'll send later on. And then just to wrap up, you can find all the information on our parent and family page and the Eventbrite page. And we look forward to seeing you at future parent and family events. We have, so Mohammed will just drop the links in the chat there. So one is just to our parent and family website, where you'll find all this information and more. And the other is to our Eventbrite, where you'll find other parent and family events that you can sign up for. Well, let me just see if that's been dropped in the chat. It's been dropped in the chat. You can access those links there. And yeah, thank you so much for joining us.